Hi, team. I'm Fitz Koehler, your fitness expert and very noisy race announcer from Fitzness.com, and welcome to the Fitzness Show. Tonight, I have three incredible guests that have lost about 400 pounds cumulatively, and they did so with the help of surgery, gastric bypass, and then there's another variation we're going to talk about. But it's a topic that a lot of people are intrigued by, perhaps confused by, and I'm not going to claim to be an expert on this type of surgery, but who better to explain the pros and cons, the good, bad, and ugly than people who've had it. And, my opinion up front as a highly qualified and experienced fitness expert is that, ideally we want everyone to be of ideal weight by eating healthy food and moving their body and getting quality sleep and removing the cranky people. That always helps. But obesity is lethal. It's a fatal disease. You may not call it a disease, may not be the word that works, but it will turn fatal eventually. And so I do think that if you're not finding a solution through the old-fashioned methods, then this is a really good choice for somebody who's, in their lives being threatened by their weight. So I'm really excited about this conversation. I've actually never had lengthy conversation with people who've had any sort of bariatric surgery. So my guests are awesome. They're people I genuinely like and admire. And one is actually even an old high school friend. So couldn't be better than this. We're going to start with that guy, Mr. Pierre Venant, the gentleman. Hello.
Hello, Fitz. How you doing?
I'm thrilled, Pierre. So happy to have you. We also have
here.
fellow Gator and running fan, Miss Taryn Buckley. Hi, Taryn.
Hi, everyone.
Hello. And then the beautiful and talented, who's also a big Disney fan and runner, Christy Woodard. Hi, Christy.
Hi.
So before we get into weight loss surgery and fitness, I always like to, find out a little bit about my guests besides the weight loss stuff. So I'm going to ask you each, just real quickly, who was your very first Hollywood crush? Aaron, you're up.
Had to think on that for a minute. I'm like, I guess not Hollywood, but I'll go with one of the Backstreet Boys. That was Hollywood. So, yeah. Okay. All right. So Kevin Richardson from the Backstreet Boys. That was probably my first crush.
Okay. All right. A cutie. And Christy, what about you?
Well, I'm an 80s girl. So it was the Rob Lowe, Matt Dillon, C. Thomas Howell. I had all those posters on my wall.
Outsiders, the whole Outsiders stuff.
Yes.
Very good choice. And Pierre, what about you?
I'm going to have to go with my all-time favorite, J. Lo, Jennifer Lopez. Yes.
And she's taken. Are you okay with Ben Affleck? How do you feel about that wedding?
I mean, he's a nice guy, but definitely if that doesn't work out, she knows where to find me. Hopefully she knows where to find me. I'm not available.
Yeah.
But, yeah, she's definitely on my list.
J-Lo's a total hall pass, by the way. I don't care who you're married to or who you're dating. J-Lo's the ultimate hall pass. All right. Favorite sport to watch, favorite sport to participate in? Christy.
Oh, running for sure. Yeah. Disney running. And now I like watching the marathon. Who would ever thought that would have ever happened? I love watching that.
Okay. All right. Me too. So both of those, running. What about you, Taryn?
Soccer, hands down. That's the family go-to. I grew up playing soccer. My husband and I met. We were both soccer players. And if we can, we try to go every 4 years to the World Cup together.
I was going to say, I believe I've seen you at the World Cup.
Yeah.
Really cool, Basha. And that's your favorite sport to play and watch?
Yes, absolutely. Can't play it. My knees aren't as great as they were when I was in my teens, but I do a lot of running now. So I guess that translated a bit from soccer.
Yeah, it definitely did, for sure. And Pierre, what about you?
I mean, for me, I'm going to say college football is one of my favorite things to watch, and also UFC, mixed martial arts fighting. Trained in kickboxing and Muay Thai over the last couple of years. And definitely between watching college football from my college football days and, high school football to UFC, those are the favorite things I like to watch. And as far as things to do now, I love to run. I've done a bunch of 5Ks. I've done a bunch of Tough Mudders, Spartan races. So definitely enjoy running and obstacle races. And then I just started doing duathlons where cycling and running at the same time. So definitely try to expand my horizon when it comes to running. And, you know, 'cause I know I'm not going to be able to fight in the UFC or play football anymore. So I might as well run and bike to keep me healthy.
Yeah, well, and Mr. Endurance athletes, don't be surprised if you start swimming too. You'll just land there. Yeah, I know.
Yeah.
Don't be surprised. All right. So thanks for letting us get to know you a little bit outside of this weight loss journey. I would love to know, what you were like before your surgery. So the Cliff Notes version, but tell us what you weighed or how much overweight you were, depending on how much you want to reveal. And, what was your life like when you were at this concerning weight? Christy, I'm going to start with you.
I started gaining weight in my 30s after I quit smoking, and I had gotten up to 251 pounds. I'm 5'6", and I was still trying to run, but I discovered running just in 2014, but it was harder with my weight. I now have a torn meniscus and I've had some issues, but I was having uncontrollable GERD and acid reflux with every meal I would eat. I was pre-diabetic. I was having hypertension. They sent me for a stress test. So I could see myself as my 50th birthday was approaching. I could see myself just getting old. And a doctor that I met with, said to me, Christy, how many elderly obese people do you see? And I thought, oh my God, none. None. So I knew I had to get some control. So I was 250 pounds when I decided that I needed to make a pretty major change.
That's yeah. I ask people that too. How many 400-pound 70-year-olds do you see around? And the answer is just none. They don't exist. So,
and I never considered that. And I actually thought that was a mind-blowing moment for me. And then I spent some time looking around and I thought, oh my God, that's a thing. Yeah. I'm going to die. I need to get my stuff together.
That's great motivation. Great motivation. Pierre, what about you? Life before surgery.
Life before surgery for me, for up until my younger days, I was always in shape. I've always been athletic. Played high school football, played college football for a little bit, and then worked in nightclubs. So I always worked out, stayed in shape. And like Chris said, I didn't start putting weight into my 30s, where before I would stay right around between 250, 285, but solid muscles, but then got hurt and right around my early 30s and couldn't work out the way I wanted to work out. So I started eating more because of the way I used to train, because I used to lift a lot of heavy weights and stuff. So I went from being about 250 to 285, where I blew up between work and medical problems, back pain. And it seemed like as things happened and I put on more weight, I incurred more medical issues. And I went from like 250, 280 up to 380 plus pounds. And at that point in time, I realized in my life, I needed to make some change. And even between, I would go up to 380, drop down, I would work out. I think I did one of my first Tough Mudders and I weighed about 325. And that was a 14-mile run. Did that race and couldn't walk straight for like a week, but definitely was a life-changing experience for me, and definitely wanted to find a way to get back into shape and, bouncing back and forth. And as you get older, things get rougher and makes it a little bit more difficult to lose weight. So ultimately I had to make that decision.
Okay. And Taryn?
So I too was pretty active growing up, soccer, very competitively, even played in college for a bit. And I would say some of those struggles came in college with weight and just kind of eating. Same as Pierre said, you're so used to eating a certain way while you train, and even getting away with eating lots of junky food because you're going to expend so many calories. So it's really hard to make that adjustment when you stop doing those activities and you're still eating junky, So gained a little bit, had that freshman 15 that was easily stacked on, lost it, gained it again after I have two beautiful boys and gained lots of mommy weight. With the first son, I gained like 85 pounds. I lost most of it. Then I got pregnant again with our second son, and I actually was running half marathons throughout the majority of my pregnancy up until like the 6-month mark. It was a goal to run every single month of pregnancy, and I did that. But still, despite that, still managed to put on 60 pounds after that child. And then it just became really hard to lose the weight after that second pregnancy. It was almost everything you did. I remember pouring into myself 100%, working real hard. And each month you'd be like, okay, I've only lost 5 pounds after doing everything I'm supposed to do, tracking everything, working out. And then things just kind of spiraled out of control from there. I got up to about 318 pounds. Around that was my highest. And it was just very difficult to come back down. Diagnosed with diabetes, sleep apnea, almost every single thing, PCOS. So lots of doctor's appointments, up to 20 prescription medications, and just couldn't really get any of it under control. So a combination of my doctors were the ones who basically, kind of like Christy said, that wake-up call, hey, you're young, you've got these young kids. You want to be around for that? You're winded walking up the steps. You're going to Disney and you can't fit on roller coasters. This isn't fun, So a lot of those kind of factors came in as I was making decisions about what to do next.
So when it was recommended or suggested to each of you to have surgery, did any of you say yes right away, or was it a difficult decision to make? Chrissy?
Well, for me, it was my decision. So a few friends had bariatric surgery, either the sleeve or the bypass, over the last couple of years with a doctor out of Baltimore, Dr. Betsy Dovek. And so I started following her on Instagram for like 3 years, just kind of stalking her from the side, and never really sure that I wanted to do it because it's permanent. And my God, am I really ready to give up the Cheetos and the bad choices and the excuses? And I wasn't sure. So when I brought it up to my doctor, whether it be my gastroenterologist who I'm seeing for the GERD or my gynecologist, I thought somebody would say to me, well, you don't need that, but no one did. Everyone said, that's a great idea. So it was me watching and thinking about it for a long time, several years. And then honestly, it was a trip to Disney and almost not fitting onto a ride. And it was a candid photo that was taken of me that I saw that, because, I control all the photos from here, way up high, and you don't get to see any of the stuff. And I saw this picture and I legitimately did not recognize myself. And it scared, and it freaked me out. And I thought, I've got to make a big change. So that's how I got to that decision.
Yeah, powerful stuff. I just had a guest, Janelle Cooper, on my show a couple of weeks ago. Janelle's lost 120 pounds, and she was inspired by a photo. Someone just took a picture of her, and she had no idea, as she says it, she had gained so much weight. It was a photo. So for everyone hiding from cameras, stand in front of them. Let's get the real honest view. Maybe you take action upon those photos, right? Your brain
will mess with you. And I didn't realize to that level. I mean, I knew I was overweight and I knew that I wasn't as heavy as I should be, but I legitimately didn't think I was as heavy as I was. But I wouldn't get on the scale. Yeah. I wouldn't even get on the scale at the doctor's office. I mean, so I knew, but I that candid photo, I mean, I can close my eyes and remember seeing that picture and having that, like, it was strong. So,
Wow. And Pierre, what about you? How were you convinced to go for the surgery?
I mean, a lot of the same reasons as well. Basically, for me, I think one of the moments that really pushed me to have the surgery, because, I would gain weight, lose weight, gain weight, lose weight. So I never thought I really needed it until, one day I went to dinner with some friends of mine, and halfway through the dinner, I just didn't feel right and almost passed out. They had to rush me to the emergency room. They had to do a bunch of tests and stuff on me. They had to do some cardio stuff on me. And then it got to the point where it's just, I got tired of going to the hospital for different reasons. And, you know, my heart went into AFib. So I had to get do a cardio version, get my heart shocked back into rhythm and stuff like that. So when you add the sleep apnea, you add the cardio version, you add the fact that I'm at a restaurant and I almost pass out and my friends had to carry me to an emergency room. It gets to a point where you say, you know what, Pierre? Yeah, you used to be the man, you used to be the athlete, you can lose the weight. And even though you weigh 315 pounds, you still play in a men's basketball league for, you know, I did that for like 7 years at 350 pounds. I played in a softball league every Sunday. So I'm like, I'm active, I'm doing all these things. But it got to a point where my body just couldn't take it no more. Between the medicine, the sleep apnea, sleeping with a machine on your face every night, it gets to you. So basically it was my decision. I just got tired of being sick. I got tired of, you know, not knowing if I'm going to wake up or if I'm going to die in my sleep and stuff like that. So that definitely, you know, enhanced my reason to get the surgery. I have a young son who's 23 now, and he used to remind me, like, man, Dad, when we were younger, we used to go to the batting cage a lot together. We used to go play sports. We used to go play basketball. But then as I got heavier and stuff started happening, it got to the point where it's like, yeah, son, we'll go later because let me rest. Give me some time. Let me take a nap before we do stuff. So it got to the point where I was just like, you know what? I've tried to lose weight. I tried the different diets. I tried, you know, HCG shots. I went to this program, the Atkins diets and stuff like that. And once again, I would lose the weight. That was the greatest thing for me. It's like I could lose the weight. I could lose 50 pounds in like 2-3 months. But then something would happen, some type of medical issue, and then I would slide right back. So then I got to the point where I said, you know what? Did some research. I had a friend of mine who worked with me. She had the surgery like maybe almost 20 years ago. And, you know, I asked her, like, hey, you know, what do you think about the surgery? She told me, because she was a very heavy set, and she told me all the things that she was experiencing, and I told her everything I was experiencing and how she had the surgery and it changed her life. And then I said to myself, I was like, you know what? I want to live a long time. I want to be around for my son. And I just turned 50 in May, and I'm living my best life now. Had the surgery 4 years ago. So to be almost 400 pounds to being under 200 pounds, you know, or right around 200 something, it's night and day, you know, so it's a better life. So it's a choice that I felt that would correct everything that I need, and no sleep apnea, no medical problems. I don't take any prescription drugs anymore. Just the best decision in my life.
You know, I love that you guys are talking about these pains and discomforts, because there's so many people right now that are overweight and they're blaming their sleep apnea on something else or their knee pain on something else. But the reality is most of these aches and pains are coming directly as a result of their poor eating habits and their weight gain, you know, and it sounds like many of these nasty symptoms you were experiencing have gone away since you guys have lost the weight. It's incredible. Yeah. Taryn, how did you make the decision to have surgery?
I remember pretty much for like 3 years kind of kicking and screaming at my primary care, GYN, pulmonologist, endocrinologist office, because they all were recommending it to me. And I was like, no, I can do this by myself. I do not need to have surgery. I have gained and lost weight. I've done it before with another child. I've done it in college. I've done it. I can do this. And for 3 years, I was saying that, down to the point where finally, you know, we're seeing labs from endocrinologists, and she's like, look at your food diary. As long as you're being honest here. And I'm like, I truly am. She's like, this doesn't make sense. None of it makes sense. You need to do something that is actually going to just shock your body back into rhythm. And I just was still so hesitant. The stigma on it is so real. And I didn't want to be perceived as somebody who I felt like maybe even doing weight loss surgery might be quitting. Quitting, people like to see that as like you take the easy way out, and people say that, and God, it's been nothing has been easy about this process at all, you know? No. But yeah, I remember having to overcome some of the stigma and emotions tied to that before I actually said, yes, okay, let's do this. And even at the point of me saying yes, it was a whole nother year of labs and testing and nutritionist visits and consultations with, you know, all kinds of things, making sure that I was being diagnosed with sleep apnea. Are you using your CPAP machine? We're downloading the data. We're going to look and make sure that you are. I mean, it was so intense, almost a whole year of just making sure I'm doing everything right before I could even be approved by my insurance for the surgery. So even after saying yes, there was still so much work, that went into it.
Absolutely. So we've talked about the physical stuff. What was it like to be in that much bigger body, mentally, emotionally? What were the burdens that came with that? Taryn, you can start.
I would say for me, and Pierre touched on it too, something with the kids. I spend any bit of free time I have on my kids, even if it's not free time, you're being pulled in the direction of your children. So we're active family and we love to be out and about. And I had so many limitations. There were so many things I could not participate in with my family. And that it really did a number on me, really. The roller coasters were always a thing. I couldn't fit on a darn thing at Universal. Disney's a little more gracious on their rides, but Universal was a hard pass on, 98% of the rides. So I truly was there being a stroller pusher. It was awful. I had no fun. We would go to cool places and go on family hikes, and I would have to take a lot more breaks. I needed to, we're going to go zip lining. Oh, you can't. The weight limit for that is, 225 pounds. Every single thing was like, and you had to put on this brave face in front of your family, like, no, it's okay. Enjoy yourself. I'll just be out here waiting. Have fun. And, they go and they do their thing and you are just hanging back, crying, being left out of something again. And how much I have to fake that I'm okay with this when I'm really, truly not.
Yeah. It's hard. People say it's hard to get fit, but I think it's really hard not to be fit. Sometimes there's some serious punishing side effects. Christy, what about you?
Yeah, I mean, but listening to Taryn, it just, it always makes me cry. I recognize all of those feelings. I have a almost 5-year-old granddaughter, and she'd want to play on the floor with me, and I just couldn't get up and down. And I'm like, I'm 49 years old and staring at my 50th birthday. I'm not that old yet. I mean, no, I'm not that old yet. And I could just see the future laid out for me. My daughter would take a video of, everybody's here at the pool or doing whatever. And I am miserable and I can hear my breath. I can, the heavy breathing. I don't even know I'm doing it until I watch this video she's put on Facebook or, she sends it to me. I mean, she really knew better than to post something on Facebook. I'd die if it was a photo of me in a bathing suit. But I also feel bad about kind of this struggle with my kids watching me with this struggle with my weight, and wanting to show them that, that it's possible to change your health. And as I hate taking prescription meds, but like Pierre and Taryn, I'm like taking all of these medications every single day. And I didn't feel like me anymore. I felt like someone that was in this body that didn't belong to me, that I couldn't get out of. And no matter what I did or what I tried, Weight Watchers, phentermine, intermittent fasting, I would lose some, I'd gain it back and then some. And I felt lost. So,
yeah. It's a good description, Pierre.
I mean, for me, I think some of the struggles of being overweight and dealing with the pain of always taking stuff, Advil, Tylenol, whatever, to kind of get through my day because, I was always, I try to stay active and it would hurt me just to do those certain things. I couldn't walk into Men's Express and buy clothes. I had to find stores that had the big and tall section and go into a big and tall specialty store and knowing that if I buy a shirt, it's $20-$30 more because there's more fabric there so to cover me. So it just, those are the kind of things that when you don't understand when you're heavy, you're dealing with it. You got to find clothing, you got to deal with the pain. One of the worst moments of my life was when I got on an airplane and I sat down and I always told myself, don't need the extra buckle. You don't need the extender buckle. And then one time I got on a plane, and I would say the plane was a little bit smaller than normal, but I could not close the buckle on the thing. And the airline stewardess could tell that I was very uncomfortable, and then I was, kind of down, and she kind of walked by and it's kind of slid it to me without anyone seeing it to kind of, keep me from being embarrassed, because I was at the point where I was going to have to ask somebody, hey, I'm going to need one, but she could tell that I was struggling with it. And she came by and she gave me the extender without anyone noticing it, so that way I can put it on myself and stuff like that. So being overweight, it's just something that's difficult. Nobody wants to be overweight. Nobody wants to go through that, but there's a lot of difficulties, pain, the medical, I play basketball one day and for 3-4 days I'm limping, and everybody's like, man, you're so big, why you keep playing basketball? I'm like, well, I'm trying to be healthy so I can get in shape, but it hurts me as much as I try to do stuff. So definitely those are the things that, people have to consider when, weight is just not just being big, but the pain and suffering that you deal with on a day-to-day basis, and embarrassment from dealing with it as well.
You know what I love is that not one of you mentioned a swimsuit, right? You're no one's like, I need to look great in my bikini or whatever. You have real life, daily struggles, obstacles, feeling, pain, sleep problems. It's quality of life over and over. And, when I try to encourage people to exercise and eat right, I always say, listen, if you want to look a certain way, that's on you. This is about living well and living long. And you all have really driven that message home, because you had to, it's a fairly radical thing to do, go have this surgery, but the outcomes are pretty great. And I do have before and after photos. So anyone who's watching thinking, oh my God, I want to see what they were before, we're going to get there. And I promise to show the videos with some proof, before and after proof. So you've decided to have this surgery. I want to know the good, bad, and ugly of the surgery, again, in Cliff Notes, because I want to get to a lot of things, but what was that like? And was there something like, oh my God, I didn't know this was going to, like with cancer, I could tell you a whole bunch of weird effed up stuff nobody warned me about. What's the weird thing, and what went really smooth and worked for you? So Taryn, let's start with you.
So my, I'm the panelist that had my surgery was the duodenal switch. So a little bit different from gastric bypass in that there's still bypass involved. My stomach was sleeved, but also the bypass goes a little bit further. So attaches down much lower the end of the small intestine. So it kind of creates malabsorption and a lot of nutrients that I would, need to take or I will have to always supplement vitamins because I'm bypassing so much of the small intestine. And that was very clear from the beginning. I think what I've realized over this last year and a half really is just kind of like I swapped my prescription medication for vitamins. Okay. So I'm still taking lots of vitamins to help with and then the commitment to making sure I have labs done all the time. I remember actually at the point of surgery, when it was time to go into the OR, they were told, oh, you'll be in for X amount of hours. My husband was like, you were in the OR for almost 5 hours. So that kind of freaked everybody out because you're only supposed to be in there for like 2 and change. Okay. And the surgeon's like, oh my gosh, the scar tissue was insane in there from previous C-sections, from having my gallbladder removed. The surgery lasted way longer than we thought it would, which meant we pumped her with way more gas than we thought. So she's going to have a lot of gas pain. If she doesn't get up and walk around constantly as soon as she can after surgery, she's going to have a lot of stored up gas from being under for so long. So encourage her to walk around. And I sure was. I was in there with my hospital socks, my little gown, walking around. Things you didn't realize. In the hospital, they're going to be bugging you all the time, making sure things are okay, poking and prodding. And then, it's time for you to go home. and all these little things that you were having help with at the hospital, you're now kind of doing on your own. You're, having to try to focus on drinking, keeping your fluids. And despite the fact that you can only get in tiny little bits at a time, I didn't really know how long I was going to be on a liquid diet for. Oh my gosh. I didn't realize after the surgery, I wasn't going to be able to drink the protein shakes that I loved before. Aren't going to work for me post-op. They taste totally different. I all of a sudden have a reaction to whey. I can't have anything with whey. So now I have to get in this insane amount of protein, but I can't have any whey. How am I going to do this? I'm on a liquid diet. It just kind of, things felt very overwhelming when I got out of the hospital. Thankfully, when you have a good, team behind you, or really grateful for some of these Facebook support groups that have really good advice and suggestions of people who've been there, and really good nutritionists. I had my procedure done at Advent Health. They really kind of, everybody chimed in to figure out what was going on, what I needed to do. But I was just absolutely, totally unprepared for all of those curveballs at the end. Having a allergic reaction to the pain meds. I got an allergic reaction to the surgical glue they used on every single incision. So I had 7 sites where they went into my body, and I had an infection at every site.
Wow.
I just wasn't prepared for that. Part of the recovery since then has been much easier, but I felt like people, they skip over some of that scary stuff. They don't want to scare you going into the procedure. They don't want to tell you the what ifs, but I had so many curveballs within the first month of that procedure. It was kind of terrifying to think, oh my God, I hope the road is going to be a lot smoother going out. It was really bumpy coming out, but much smoother now.
Not the easy road everyone claims it is.
No, not at all. Not at all.
No. And for our viewers out there, if anyone has a question or a comment anything you'd like to ask or share, please do. I've got Dr. Levon giving some messages here. I believe did you also have this surgery, Dr. Levon? Let us know. Christy, what was your experience like?
So I live in Maryland, and when I decided to have this surgery, I decided that I wanted that surgeon that I'd been following for a few years to do it. Felt like I knew her after some friends had surgery with her, and she's pretty good on social media. I decided to do that just as she packed up her bags and moved from Baltimore, Maryland to Advent Health in Orlando, Florida. Wow. So I thought, I think I'm going to follow this doctor to Florida. So I did. And I traveled to Florida from Maryland for gastric bypass with Dr. Dovek at Advent Health. And I have to ask Taryn how far out she is. I don't think, did you say, Taryn, how far out you are?
I'm about 18 months.
18 months. Okay. So I had surgery in January. So I am 6 months out. So I flew down to Florida. I had to rent an Airbnb, and my surgery was a bit different than Taryn's experience. And that's certainly something that I have noticed in the bariatric community is every experience is very different. I'm a prolific researcher. I've read every book practically, listened to every podcast, read every Facebook group and Instagram community. So I felt, and I took it, like Pierre and Taryn said, it took us 8 or 9 months to go through this process. So I felt like I had a good handle on what was going to happen, except I had in my head thought I was going to have the sleeve, and my doctor and I discussed it, and she talked me out of it. And I went with the gastric bypass because of the GERD and the acid reflux I already have. And she was 100% right. So I had the surgery. I did not have to stay the night. It was a same day procedure. I had the surgery. I was in the operating room like 40 minutes. I was back at the Airbnb by lunchtime. So very different experience than Taryn. The first, they gave me, I think like 5 Dilaudid. I think I took 2 of them. And after on the end of the second day, I started to feel better, but I woke up from that surgery and I just kept saying, I have chest pain. And that nurse was like, Mrs. Woodard, if you keep saying you have chest pain, we're going to have to call a cardiologist. Do you have chest pain or do you have gas pain? I was like, I have gas pain. So I was like, because that nurse was getting ready to cut me. So a lot of walking, and that was what Taryn talked about. You've got to walk. Your stomach has been inflated, full of air. But by that third day, I felt a lot better, and I had surgery on a Tuesday, and I flew back to Maryland on Friday.
Wow.
And I spent the next week, another week off of work, just trying to learn how to take tiny little sips and, and tracking everything. And I'd write everything down. And I kept very detailed notes. For me, kind of the biggest problem I had was going to the bathroom. Bariatric patients like to talk about going to the bathroom.
Yeah.
It becomes a problem.
Really? How come?
Because you're getting about 5 grams of fiber a day. All you're eating is protein.
Oh, so you stopped up.
Yeah. Yeah. Everybody's like, oh yeah. So I think that was the biggest problem I had post-surgery. It was just like reaching out to my doctor going, I'm going to die. When are we going to get this out? But then I still struggle with that a bit. I think a lot of patients do. And I'm earlier than a couple of the other panelists, but for me, it was what I expected. It is hard, but I expected hard. I think I expected the worst, so it's not as bad as I thought. But I feel like I was ready. And when I was in the room ready to go under the knife, I was not nervous. I was so ready to start this new life. And like Taryn alluded to, and I guess we'll probably talk about, is the stigma is so great. And, I have friends and family who are judgy, some to my face, some behind my back, who, don't, I could never do that, or I do it the natural way, or I have to do it, the old fashioned way. Well, good for you. I'm happy for you. I mean, not everybody can do that. I'm also menopausal and everything is just a mess. But it is hands down the best thing I've done. And the only thing I regret is not doing it sooner.
Wow. That's pretty powerful stuff. And I got to tell you, those judgy relatives, they were judging your weight before they would judge your hair, your makeup, your clothes, your job. They're judgy people. And, I think judgment is always a good thing because you judge whether or not it's safe to walk out in front of the road. But yeah, if they're going to be nasty anyways. I'm glad you fended for yourself and saved your own life.
What I try to do is remember that sometimes a lot of those comments, and this is how I do it, it's not about me. Their comments are about their feelings about their own weight.
Yeah.
Most of the time. Not always, but most of the time. So I just try to remember that and know that it's not about me, and just kind of reject what they're putting out there and go on with my life.
Yeah. I like the old saying that says, what you think of me is none of my business.
That's right. I like that.
Go on. All right. And Pierre, what was your surgery experience like?
I mean, for me, I always tell people, you can listen and read all these different things, and everybody's experience is different when it comes to surgery. You hear some good stuff, you hear some bad stuff. Ultimately, for me, my surgery experience was wonderful. They warned us about gas and making sure you walked. And I know when I was in the hospital, I walked so much that the nurses are like, we're getting tired. Go back to your room and sit down, and because I'm such, college athlete, football, I'm like, all right, I got to get this done. I got to get back into the game, coach. So I got to do everything I need to do. So for me, surgery was a breeze. So no complications there. Funny story. My mom, I told her to come stay with me for like a week. I'm like, hey mom, I'm gonna need you to help me out because I had the surgery, and I didn't tell her everything about the surgery, but I'm gonna need you to help me because I'm not gonna be able to move around much. And my mom uses a walker and stuff like that because she's had some back problems and issues. So she comes over to my house, but I'm getting up so much and walking around. She's like, why am I here? I could have stayed home because you don't need no help. I'm like, I'm sorry, mom. But, as far as the surgery itself, definitely was easy for me. No issues. I was walking. I was doing all the things the doctors told me to make sure that everything went right with the surgery. Some of the bads about the surgery, but ultimately still is good at the long run, was, losing so much weight, your blood pressure tends to drop. So you go to stand and, people mention that, but I'm like, what do you mean? You almost feel like you're about to faint. And a couple of times I remember getting up too fast and almost feeling like I was going to fall over or had to grab myself because I was going to faint. So not a lot of people, you talk about it, but you never experience it until it happens to you. So your blood pressure drops really low, and it becomes a thing where it's kind of like, okay, hey, I'm about to stand. So I brace myself, stand for a second, and then start to walk, because if I start to walk too fast, I would fall over.
Wow.
Another thing that I experienced with the surgery is a situation called dumping. And once again, you hear about it and people talk about it, and I'm like, oh, I don't know what this thing is, but it's not going to happen to me. Where when you gastric bypass, if you consume too much sugar at once, because it's bypassing your intestines, and so you get like a surge of sugar all at once that your body can't handle it, and it causes you to. It's like you almost feel like you're dying for about a good 30 minutes. Where I've had points where I ate something I didn't think was that sweet, and I ate it, and all of a sudden I had to lay down and started sweating and started shaking. And that would last for about a good 30 minutes to an hour. It depends on different people. They had that situation. So that was one of the things that I experienced here and there that definitely was not something that I was expecting, but was definitely something that I would never have felt because of the surgery. And
you mentioned dumping. So Dr. Craig had asked about that in one of the comments I haven't shown yet, but he also asked about tooth decay. Did anyone have issue with their teeth?
I mean, I've heard stories about people losing their hair because of the surgery, which is common.
Okay.
So they tell you to, take biotin and stuff like that. But as you can see, I didn't worry about my hair part. I was covered there. So, and if I could lose hair on my back, I would have been like, hey, do the surgery again. I'm good to go. But no tooth decay. But I know people had problem with acid reflux. And luckily for me, when I had my gastric bypass, I had a hiatal hernia done at the same time, which was like life saving. For me, the hiatal hernia surgery part of my gastric bypass was the best part, because I used to wake up in the middle of the night throwing up pure acid, where I had to sleep with like 2-3 pillows under me at all times because acid would come pour out of my mouth. So that was definitely a positive. So once again, that surgery kind of helped me out with there. And another thing you have to worry about when you have surgery is, I used to be a party guy, go out with my friends, worked in nightclubs. Drinking alcohol with gastric bypass could be very dangerous. For me, 5-6 drinks and I was having a good time. 8-10 drinks, I might get a little tipsy. 12-15 drinks, now 2 drinks, maybe 3, and I wake up the next morning and not remember what happened that night. Wow. Because alcohol hits you so much harder that you don't realize that you're at a point where you're feeling comfortable, you're feeling buzzed. The next you know, you completely black out. And that's one thing over the years. And like I said, I'm 4 years out. So my first year and a half, maybe almost 2 years, I didn't drink any alcohol after my surgery. But then eventually I started to drink here and there. But then I realized certain situations and certain levels of alcohol, I had to be careful because I would not remember what transpired. And all my life I've worked in nightclubs and I've never had a problem with drinking. And I've always been the guy that, hey, he drank 10, 15 beers, but he's still sober. With this, I Uber, I make sure other people drive, because when you drink with the surgery, it definitely can cause complication and you feel it a lot more.
Ladies, have you had any experiences with alcohol since your surgery?
Well, for my program, you're supposed to be 12 months without alcohol. However, I just turned 50 in June. So I talked to my surgeon. I was like, well, how do you feel about me or my nutritionist, having a cocktail or two? And they were like, just, don't overdo it and get back on the program. And the other reason they don't want you to drink is, in addition to like it being caloric a nightmare, when you're in that first honeymoon period, transfer addiction is a real thing. So they don't want you to transfer the addiction of eating into alcohol and becoming an alcoholic. So, and I really like to drink before surgery. So deciding to give it up was also a consideration. So I did have a couple drinks on my birthday, on my 50th birthday. And oh goodness, like Pierre said, I mean, I had 2 martinis and I was like, wow. And I could have like 4 and be okay. I had 2 martinis and I was pretty lit, and that I felt like I wanted to die the next day. So I'm not. Yeah. How about you, Taryn?
Yes, very similar experiences. And that's what, and I had always been nervous too about introducing alcohol for exactly what Christy said, the transfer addiction, just not knowing what, okay, so if I'm trading off what I'm eating and what I'm doing, what's my new what's my new thing going to be if that goes away? And I didn't want that to be alcohol. I did, same as Christy was like, my program was 12 months. And mostly, you know, the other big reason for that is just because of the rapid weight loss. Your liver is already processing so much. And all of us, when you see the labs, you see your liver enzymes and over time, and you're just like kind of floored at how much your liver, how hard it's working already. So introducing alcohol into the system just really puts it into overdrive. It's already working really hard processing the weight loss. So it doesn't make sense to add the alcohol factor. But I'm right there with you guys. One drink, and it for me, it's like you get buzzed pretty quickly. And the kind of, to me, also the kind of scary thing is the feeling of being buzzed also goes away rather quickly.
Yeah.
So I can absolutely see where it would be problematic for somebody who's potentially saying, well, okay, I got that one drink down and now I'm feeling better. And like 2 hours later, let me have another one and go from there. I can absolutely see how it's easy to consume it, get over the feeling of it, and keep going. So it is, you know, I urge anybody who's doing that to just be cautious of that, your body's capability of doing this, you know.
That's a fantastic advice on a topic I did not think we'd cover. So I love that. Now, when you come out of this surgery, they've either taken 80% of your stomach away or turned it into a little pouch. So as I've been told, is you can only eat very, very small amounts. So what is that experience like? And for all of you, how quickly did the weight start coming off? And what were those first few weeks and months? What was the excitement like as the weight did start falling off? Pierre?
I mean, for me, the first couple of months was like awesome. And I was one of those people that, like I said, the moment I was bothering my doctor, when can I start working out? When can I start working out? And then I started walking around my block once, twice, and then 10 times the first month or so. So weight was coming off of me left and right. Being a former athlete and stuff like that, it's almost like I knew how to train and how to do stuff. And it kind of helped me to lose the weight faster. So it was easy for me to get the weight off and stuff like that. So I appreciated that. I think within the first year, I think I lost like 120 pounds easily. And it got to the point where I think eventually, I might have posted on my Facebook page, I ended up doing a physique competition and, you know, lost weight for that as well. But I guess the first year was this easy, exercised, I worked out a lot, and it just came off like with no problem.
Incredible transformation. The photos are pretty staggering. How much weight have you lost total so far, Pierre?
The total amount was 160 pounds, but I got to the point where I got so skinny, and I think I sent you one of the pictures of me skinny and then not working out and then working out. So I got down to like 215-ish, and everybody was like, "You look sick. You look like you have a disease or something like that." You know, we know that you're a big guy, but we're so used, you know, and you lost weight, but at the same time, you look like you lost too much weight. So right now, I got up to about 225 to 230 is where I stay comfortably, because that's more muscle mass to kind of keep me looking big. So people, because they remember Pierre, the bouncer guy, Pierre, the football guy, you know, so I didn't want to lose too much weight. So I actually, you know, between working out and proteins like that, I'm right around 235, 240, depends on how, you know, my morning or dinner and stuff like that. But in total weight was 160 pounds I lost from the surgery.
Wow. And I remember watching your weight loss. You went very public with it on social media, posting pictures all the time. And it was dramatic and exciting to see your constant pictures changing and the updates. Really, really good stuff, Pierre.
Yeah, I just want to add, you know, and I tell people I post, you know, not to brag or not to show off or nothing like that. You know, I had the weight loss surgery, and to lose weight and to be healthy. Because of being healthy and not in pain, I'm able to work out and do the extra working out. So I got to a point where I started to look muscular and look good.
Yeah.
But since the surgery, I've had at least 8 personal friends who've had the surgery and write me and say, Pierre, because of you and seeing the life you live, the smile on your face, the running events, the biking events, the physique competition, they decided to have that surgery. My own sister had the surgery May of last year because of, and she's been overweight for most of her, not most of her life, but for a while. And she thought about having the surgery years ago, but got scared and decided not to do it. But then after watching me, she said, bro, I was scared before. I've seen you. I've seen that you live a good life. You're having fun. You still party with your friends. You're doing all these things. And the surgery changed you, and it changes your body, but it didn't change the person you are, and you're living your best life. So she had the surgery May of last year, and so far I want to say she's lost over 100 pounds already herself.
Congratulations to her too. That's really exciting. That's really, and the sharing goes a long way, right? Sharing is, great support. Christy, tell us about what it was like post-surgery and your weight starts coming off. What has this experience been like?
So I'm newer than Pierre and Taryn. So it started off about 4.5 to 5 pounds a week the first month. Oh gosh, this is photos. 4.5 to 5 pounds a week. And I've been averaging about 4 pounds a week until the last month or so. That's a good one. Right now it's about 3 pounds a week. I just started exercising. So unlike Pierre, I was not jonesing to get back to the exercising as much. So I, honestly doing this, just trying to be a good bariatric patient, it's full-time job. I mean, tracking everything, and I'm tracking all my food, and I'm tracking my water. You've got to get 64 ounces of water a day, 80 to 100 grams of protein a day. You got to take your vitamins, your calcium every day. It's a full-time job just doing that. So I didn't feel like I was ready to go to the gym. At least that's what I tell myself. So I started going, I hired a trainer, and I started working out twice a week about 3.5 weeks ago. And since I started, my weight stalled. So I also, for the first time since surgery, I'm hungry, which is normal, right? If I'm only eating like 700 calories a day, and now I'm exercising, I got the okay to try running. I'm going to run the Richmond half marathon. That's the plan in November. I clearly can't continue. This is not going to be forever, but I need more food, but that's making me nervous because I'm used to eating 3 ounces and such a small amount of food. So am I stalling because I need more food? Am I stalling because I'm exercising? I mean, I don't even really know. I'm still trying to figure it out. So maybe Pierre and Taryn can tell me what to do.
Basically, this is what I tell people, when it comes to the scale, when you're working out, you don't look at the scale. And you always hear this thing, muscle weighs more than fat, right? And a good example of that is I weighed 225 pounds and I was wearing a size 36 pants. Started exercising, stayed at 225 pounds, and now I wear a size 32 pants.
Wow. Huh.
So it's not the weight on the scale that you're going to stall a little bit because your body's going to readjust to the weight training, and you're going to feel hungry. But as you put on more muscle mass, you're going to be leaner. So I tell people, don't look at the scale. Look at your clothes on your body, how you feel, how you dress, because that's what's really going to be the sign of that you're heading in the right direction. So working out, don't look at the scale, because in another 6 months or so, you might be at the same weight, but everybody's going to be like, man, you're so skinny. And that's the thing I tell people. So don't look at the scale, look at your clothes, and that's be the true measurement of what you're doing.
That's hard to do, right? Because this whole program, it's all about losing weight. And I get on that scale every day, and I get on, after you go to the bathroom, before you drink any water, completely naked. I don't even put my watch on because this weighs too. And, and I get on there and I look, and, if it goes up by 0.2 or 0.3, I know it's not a big deal. It always goes down. So it's kind of surprising the last couple of weeks. It's just going up by 2, down by 0.2, up by 0.2, down by 0.2. It's not really doing anything, but I do feel stronger. I feel like I am making progress with my strength. And so I will take that advice. I want to be I want to be like Pierre and Taryn. I mean, that number is, 5 years. If you're out 5 years and you are still successful, you're going to remain successful. So people do regain. It's okay. It happens. It's completely normal. I know that, but if it happens to me, it's going to suck. Because I am trying so hard to be very open. I was not until about May. And then, I'm like, I'm going to be that girl. I'm going to be the poster girl for it. And like Pierre, I put it out there into the universe. And I've had several friends reach out to me, tell me they're thinking about it, asking some advice. I've had a few people tell me they're already in the process. I had no idea. So, I feel good about that. I feel good about sharing my experience, sharing what I've learned, and letting people decide what works best for them. So I'm excited about what comes, but these guys are further out than me, so they have a little bit more experience on what comes after month 6.5. So
wow, it sounds like your first 6 months have been extraordinary. So
yeah, so I'm down. Oh, I didn't say I'm down from surgery, 89 pounds. So from January 25th, I'm down 89 pounds. So I am really at this point like 98 or 99 pounds down since December. So yeah, so I think I'm gonna hit 100 pounds off.
What's the goal? What's the lump sum goal for you?
Well, it's funny because people always ask me that. And the answer truly is, and I mean, like really in my heart, I never had a number. It was just, I want to feel better. I want to feel like me. And now I'm feeling like me. So now I start thinking about a number. So I am 153, 152 pounds, depending on the morning. I remained around 140 for a very, very long time. I would love to put it out in the universe. I would like to be around 140. But my body's different than it was back then. I've had more kids, I don't know about these. I know Pierre, maybe we'll talk about it, but I've got a lot of loose skin, and I kind of thought that maybe I'd be the one person that didn't happen to. That did not work out for me. So the loose skin's a thing, and that's kind of hanging there. So that's not helping with my weight either.
Oh, well, we'll get to that too. We'll talk about that shortly. Taryn, tell us about your post-surgery weight loss. And
so since
and before you go on, I just want to let everyone know, everybody sent me before and after pics. Taryn only sent me one before and after pic. However, it's fantastic. So I'm going to share that.
Thank you. Yeah, I saw that. I sent more in, but I just saw that email super late. Sorry.
Okay.
But yeah, and I think it's okay to show the one. I started the journey like 318. The program asked me to lose 20 pounds before I started. I am down to 195. And I'm hovering right around there. I think my body will probably try to let go of another 15 pounds. But I am, Christy, I'm running now. So things change for me probably to around the 6-7 month mark is when I decided I was going to tackle my half marathons again. I had already started my bucket list of running a half marathon in all 50 states. And so I said, I'm getting back into it. I'm doing this. So for me, it became like a breakup with my scale. I didn't throw the scale away, but maybe, the batteries kind of died. And I said, that's okay. I'm not getting on this thing anymore because like Pierre, said, I can see the difference. I have to buy smaller clothing. I am looking in the mirror and I can actually see this. I can go for a run and I actually feel like I've shed a whole human behind me. I'm quicker, my pace. I'm like, oh my God, I'm not in the back of the corrals anymore. I actually have a good proof of time, So for me, it was setting that scale to the side because that wasn't really telling the story of what was going on with me. And I actually got into an impasse with my nutritionist because they said, oh my God, we're having a hard time giving you advice on how to proceed from here because you do need to fuel your body. I ran that picture that you saw I was crossing the finish line in my first full marathon. And they're like, we don't really know how to tell you how to fuel. We know you're going to be on a course for 5 hours. We don't know how to tell you what to eat. You're going to kind of have to try a lot of stuff on your own in your training runs. Make sure your training runs are on routes where there's public bathrooms. And that's exactly what it was for me. I can't tell you how many times I'm like, I'm going to try this gel. I'm going to try this nutrition. And my body was like, either, hey, this is great. Or like, girl, find a toilet. you are in the danger zone, you know? So it has been like trial and error with a lot of my stuff. I think I found the sweet spot. It's totally different for everyone. Even just like, you know, people tell you carb loading before a race. Like I can't do that. Like I can't do that. So I have to prepare days in advance and I have to have things ready for me on the course that work. I had to like super multiply my sodium intake to help with cramping. Things that you just don't think about. And the nutritionists are sometimes at a loss because they're not they were there to give you advice from going from 400 pounds to 150, right? Without doing intense extreme exercise. But we all have added these intense extreme exercises as our transfer addiction, I suppose, for the three of us, right? And it's complicated. It's not as straightforward, but you know, I would say try not to live by that scale so much and just look at the body of work that you've put in, you know.
I am so messaging you about what works on the course because I asked those same questions. My nutritionist, she's very good, but she said, I don't know anything about how to fuel for a race. No. I'm used to eating, you know, Cliff shots, you know, and they're just pure sugar. And I'm going to get dumping syndrome and be on the ground and pooping my pants and throwing up. And that's not going to be good. So
you're like, they're doing exercise, like intense exercise like this with bariatric lifestyle. It's insane. And
honestly, I don't know how to do it. You know, like
there's not a super bunch of support out there, right? So we're kind of, as a community, we're kind of coming together and saying, oh, hey, this worked for me. Someone in my DS community was like, I just did my first marathon. Let me send you my little mix of what I do. I put these little protein things in my pocket and this works for me. So we're all kind of just trading advice and, like I said, hoping for the best and planning your running route in a very strategic way.
That's the worst. That's right. Now, I wonder if there is perhaps a sports nutritionist for folks who have had bariatric surgery. There's got to be at least one specialist, don't you think? If not, someone should know that.
I know. I mean, I've been hunted.
I've looked at different sites and stuff like that, and none of them really have the right answer. You know, like I said, I did a physique competition the end of last year, and you know, I went from like 15% body fat to under like 4% body fat, and no one could explain to me exactly what I could eat. Like my first one, I talked to my coach, and I was like, okay, hey, he's like, you need to eat so many grams of chicken, and I'm like, well, I'm gonna have to take that. I can't eat a 6 or 8 ounce of chicken. I'm gonna have to take that 8 ounce of chicken, cut it into 2 ounces, and then maybe snack on it. Instead of eating like 6 to 7 meals, I'm gonna have to eat 10 meals just to consume the amount of protein in my body just to get the muscle mass. And even my doctor who had my surgery, when I first walked in, and I was supposed to be the story, I first walked back into my doctor after like a year or so, and the nurses thought I was there to pick somebody up because they're like, they were like, are you here to pick somebody up? I'm like, no, I'm a patient. And they were shocked because, and my doctor's like, yeah, I've done thousands of surgeries, but I've never seen someone lose over that much weight in a year's time, but at the same time put on that much muscle mass. And I had to try different things, different pre-workouts, different proteins, different BCAAs, because like you said, you might try something and my stomach said, nope, you know, or I had to pull over on the way to the gym and run into a 7-Eleven because I took a pre-workout and it just didn't agree with me. And, you know, you find out the hard way, but it's very hard to, I guess, my goal is I want to learn so I can tell people, hey, I work out 5-6 days a week and I do this, this, and this, but I haven't seen anything where someone could specifically say, okay, hey, you had gastric bypass, because there's not only this gastric bypass, there's the vertical sleeve, there's the Duodenal Switch. Each procedure is different and it's going to require different nutrients, and your body's going to absorb certain amounts of protein and not absorb it, and it's going to be different for every person.
Yeah.
So it's very interesting that you guys are now, you have not the full knowledge of a registered dietitian, but it really comes with a lot of learning and a lot of adjusting. You're not just random people who are losing weight and it's easily happened. You really had to focus on quality nutrition. If you're going to only be able to have a small amount, you're figuring out ways to get those nutrients in. It's really fascinating because, you know, as you grow a body that's much too big, you know, there's been some sort of recklessness in your behavior, right? You've really gone from less regard to fine tuning everything you put in your mouth. It's pretty impressive. Taryn, did you have something to add? I saw that.
Yeah, no, you're right on the money. We're just kind of, you turn right into just kind of really getting these things down to a science. And it's been, you know, nice to not have to necessarily track calories and stuff, but you do end up going back to that, I think, when you start to do these, you know, extreme exercise. You know, if you're just doing the basic exercise, I think you can get away with, you know, eating the way, you know, normal bariatric style and then supplementing here or there. But when you start doing duathlons, triathlons, marathons, half marathons, it's a totally different ballgame. And you might have to get back down to writing it out and really looking at your macros and figuring out what, you know, journaling again. How did I feel after this kind of day? You know, like, this is what I ate. This is what I did. How did I feel?
All that's so daunting too. I mean, it's just trying to figure that out, and, you know, having to plan your routes. And my running team, we run as a group, you know, and they're great, you know, men and women, but I don't want to poop my pants with them. I just don't want to do it. You know, and so I just, you know, one of my girlfriends who had gastric bypass, and she asked me, she said, have you put a pair of pants in your car? And I said, for what? And she was like, you're going to poop your pants. And I was like, I am not going to poop my pants. And she's like, you will. I have. I was like, oh my God.
Yes, they literally, like, Fitz. There's like literally memes. It's like, never trust a fart.
Yeah,
like,
never.
Just, yeah. It's that your body, you know, you're messing around with your intestines.
I know.
And sometimes you just don't know. And I mean, things like I said, I drank whey protein. I was absolutely fine. And then all of a sudden it was just giving me awful GI symptoms, diarrhea, cramping. All of a sudden, like, wait, what? I'm going to have to use like plant-based. It's insane. And your body just post-surgery reacts so differently. You really don't know what to expect. You hope for the best, but sometimes you just kind of got to quickly go with the flow to figure it out. And really, I think I'm probably more in tune with my body now than I ever have been, even during pregnancies, honestly.
Yeah. And carbs, like, I had a little more carbs than I should have. It wasn't bad food or anything, but I don't know, 2 weeks ago, and I was exhausted. And I can't tell. I mean, my body was such a mess. I couldn't tell anything about how any food reacted to me at all. And I had this meal, and I just, like, I could barely keep my eyes open. And it was just from the excessive amount of carbohydrates that I had. And I just thought it was fascinating that I could notice that now.
So for the folks out there watching this show, whether you're watching live or on, you know, rerun after the fact, and if you've not had any sort of bariatric surgery, the way they're eating consciously is the way you should be eating consciously. You don't have to have 80% of your stomach removed to pay attention to what you put in your mouth. If you are someone who really does prioritize every bite you take, you can really avoid so many problems. And so they have taken a measure that has really worked for them in the grand scheme of life. But this habit, you've been forced into these incredible habits, if the general population adopts them too, they could really avoid all these problems. And it's the GERD, it's the sleep apnea, it's the aches and the pains and all those things we started off talking about. It's actual health, it's actual quality of life. But being a conscious eater really is a big portion of the solution. Very impressive. Very impressive. So I want to ask you guys about the fun parts. So we've talked about the surgery and, the things you have to manage. You start seeing the changes in your body in the mirror. How many woohoo moments have you had? How many happy dances? What is shopping like? What's the best part about sitting in a plane seat with lots of wiggle room? I mean, you start, Christy.
I've never taken so many selfies of myself right now. I feel like I take a lot of pictures of myself, and I think some of my friends are probably tired of seeing them. Yeah, that's at the Marshalls. That's a Marshalls dressing room. Yeah, that was last week. So I like trying on clothes is phenomenal. So when I got into a 14 for the first time a couple of months ago, I like said some expletives very loud in the dressing room, and the woman next door was laughing at me. And I was like, I'm so sorry, I'm so excited. And I went shopping with a girlfriend last week and spent an obscene amount of money. And I bought size 8, and I was ecstatic. I mean, just and again, it's weight doesn't drive happiness. But I really wasn't thinking about, I want to be a size 8. I want to fit in a bikini. And I remember Dr. Dovek saying to me that I put one of your incisions in your belly button. So if you want to wear a bikini, and I was like, you're on crack, lady. I am never going to wear a bikini. I wear a bikini. And I mean, it's not like the sexiest thing on the planet, but I feel pretty good. And I am fascinated by my own reflection. So I know that will end. I know that I will get used to it, but for me, it's still pretty new. So like I catch my reflection and I'm surprised. I am genuinely surprised when I see myself, and I am just so happy, and I am never going back.
Are you proud? Are you proud?
I am really proud of myself, because I think this is a brave decision when someone decides to get bariatric surgery. You have to do so much work for insurance, to jump through the hoops for the programs. You've got to do all the work. You've got to do all the research, and you have to do it every single day, every single meal. And I am proud that I decided to make this change, and that I am sticking to it. And I'm not going to let any of the excuses that I've had in the past get me down, and or anybody's opinion about what I'm doing. Screw them. This is what works for me, and I feel good, and I'm going to live longer because of it. And my kids are happy with it. I mean, my husband loved me regardless of my weight, but come on, feeling better about yourself, whether you're hanging around the house or you're talking about your low life. I mean, it's better when you feel good about yourself. So yes. I'm happy.
Congratulations. I'm happy for you. Taryn, happy moments.
Probably my happiest was, it was only really a few months after surgery. I was said, okay, so my son's birthday had come up, and we went to Universal, and the last time we had gone, we went to go see if he was tall enough to ride the Hulk, and he was just too short. And I sat in the test seat, and there was just no way that the test seat was closing. Okay. And so we had kind of promised each other at this moment that, okay, this year, mommy's going to work on her. So I'm going to try to get myself smaller so we can close the test seat. And you're going to work on eating your food and fueling your body so you can get taller. And we're going to ride this ride together for your 10th birthday, right? And we got to go to Universal, and sure enough, fit in the test seat. So we had the green light. My son was ecstatic. He was tall enough to ride. And when the team member saw us, like, very excited, she wanted to know what was going on. And we shared the story with her. Mm-hmm. And she congratulated me, whisked us to the front of the line, put us in the first row. And we sat down, and my son looked over at me, and he's like, Mom, I'm never going to forget this moment my whole life, and it was just like freaking awesome. It was the best. It was like, this is exactly what I was doing this for, creating these memories and these moments and this experience. It was exactly why I was doing it. And to me, like crossing the marathon, I mean, amazing, awesome. Yes. But like my son turning to me and saying he's never going to forget this moment his whole life, like that just, you just truly can't beat that. You really can't.
So. Magic, Taryn. But also, what a smoke show at that race. Yeah.
Thank you. And I'm training right now. I'm like, I don't know that I would ever think about it before, but I'm actually going to do dopey this year. I signed up. So I am for the first time ever attempting the dopey run, which is the 5K, 10K, half marathon, and full marathon, all 4 days back. The consecutive. So the medals look gorgeous. I feel like I've run these races for the medals now.
Go for the medals, yeah.
But I'm like, I have always wanted this, be able to showcase the 6 medals you earn for running dopey. And I'm like, I'm gonna do it. Just even if I just do it once, I just want to do it. So now I'm still training for my 50 halves and 50 states. I'm about 17 states in, but gonna hopefully get dopey done in January. So those are I feel like things I probably wouldn't try to tackle if I didn't go all in the surgery.
It's incredible. It's incredible. And just so you know, is that I host races in most of the states. So if you're gonna choose, I'm releasing my fall calendar very soon.
Yes, I'm gonna do it. I have a whole bunch of states I need to check off. So I'm gonna cross
Oklahoma, Alabama. California. Where am I going? A lot of places. Come
I gotta follow you. I need to get in the car.
Yeah,
I'm gonna play with you.
All right, and Pierre, you have gone through lots of happy dances, I'm sure. Tell us about your fun experiences with weight loss.
For me, weight loss has been a positive thing, and having gastric bypass. Once again, I didn't do it to look a certain way. I just happened to achieve a look. But just being fit and happy and smiling a whole lot more, being able to go to a party and not falling asleep halfway through was always a big achievement for me. I think one of the proudest moments was when my son was like, "Dad, can you stop posting pictures of you working out or your muscle shirts? Because all my friends and girlfriends are like, damn, your dad is hot." And I'm like, okay, that's right. But it's just a good feeling just to be, positive and feel good, be able to walk into an express store, a store that I never imagined I could walk in there and go up to buying stuff that say athletic skinny. And I'm like, does that say skinny on the jeans? Oh my gosh, I'm buying some skinny jeans. I can't. And he makes fun of me because of that too, my son. He's like, damn, Daddy, your jeans are kind of tight on you, bro. And I'm like, hey, son, skinny jeans are in, so your daddy can rock them. So let me wear my skinny jeans and be happy for me. So that definitely is a good thing, And once again, I'm fortunate to where, I'm almost 6'3", tall, slender built. So when I wear certain clothes and certain outfits, it tends to accentuate me positively. I have, big arms and, I work out a lot. So walking to, like prime example, I think I was at the Bariatric convention that we had in May, and there was a vendor set up there, and I walked over to get some samples, and the guy was like, which booth are you manning? And I'm like, I'm not manning a booth. I'm a patient. And he's like, get out of here, looking like a GQ model, And I'm like, come on now. And then it was almost funny because like every event I wore a different vest and stuff like that. And, people were like, man, you're always styling when you come into to the events and stuff like that. I'm like, yeah, well, the vest is good because it shows my muscles in my arms, but it covers my belly. So that way no one can really see my belly and stuff like that. But it's almost like, different people come up to me and like, oh, you look really sharp. You really look really nice. And it's a positive feeling. It's almost like it makes you happy to do that. Even when I work out in the gym, guys come up to me and ask me advice on how to work out. And, I'm like, oh, okay. And I guess they're based on my training methods. And, when I'm working out, I look like I know what I'm doing. But all those are positive results of having a surgery. Just, it makes me smile. Like my friends say, you smile a lot more. You're a lot more active. So it's, I've done, I think in the last 4 years, maybe over 50 plus 5Ks, and and I plan on doing a whole bunch more. I keep, I do a 5K once or twice a month. So there's so many positives to it, just not the looks of it, but just the feeling happy, feeling great, being able to smile. And, once again, having my son tell me, his friends tell me that I'm hot, it's 100% worth it.
Agree. I love your enthusiasm, all three of you, and how proud you are. And there's been so much work and effort gone into this. It's anyone who's out there thinking this is an easy way out just doesn't get it. I think you've made the case for why it's not. You mentioned a couple times the bariatric community, that there's other patients, people who've gone through this, and support system. Talk about that. Any one of you.
I mean, I know on Facebook, there's several communities you can be a part of, and you can see different things. And, I definitely, when I decided to have surgery, I went into a lot of those communities to kind of see the good and the bad, and once again, everybody experience is different. Everybody's body is different, different age groups and stuff like that. But when you get the support of different people who've gone through it, you kind of have to learn what you've learned from them and kind of say, well, this may not happen to me, or, so you're gonna hear some good things, you're gonna hear some bad things. And the goal is to kind of take those and kind of just make sure you understand the what they did to have bad effects, and then try to make sure you don't do those same things that they did, so that way those effects are bad, because you hear people like, oh, I had surgery and I want to have a beer. And I'm like, well, no, you can't have a beer. You just had surgery. And then they're like, well, I threw up. I did all that. Well, guess what? I went almost 2 years without drinking because of that fact. Right now, I think it's going on 5 years, and I haven't drank soda because they said don't drink carbonation. I haven't drank soda in over 5 years. Wow. So there's so many things that you learn from the support system. I mean, definitely my family, my friends, my mother, my sister, my girlfriend, they have all been a part of my journey. That is good to have not only your family and the people that are close to you supporting you, but, have these different communities where you can go out there and research and take some good things from that, like from TikTok or Instagram. And once again, it goes back to what I said, why I post a lot of things on Facebook or in Instagram is not to show off the results, but to kind of give advice, to tell people what are the good things and what are the bad things. And it's good to have an avenue to be able to do that.
So for all of you, what are each of your advice for others? Someone who's obese, morbidly obese, they're considering this surgery. What should they know? Taryn.
I would absolutely say do your research, right? So all three of us talked about that, and Christy read books, and I went into a lot of scientific journals. I wanted to see what some of that research looked like. There's different types of bariatric surgeries out there. So, educate yourself about those three that are most commonly used, and see what might work best for you. Ask really good questions of, if you decide to do this, go into your surgeon's office with a good list of questions. You want to be able to, get their honest feedback, and remember that it's also you interviewing them to see how this is going to work, right? So ask that, and then, keep that support system close by. You really, whether it's your family or friends, it's really up to each individual whether they want to go public with this information or not. But I highly suggest at least letting one person know. You don't have to tell the whole world. You don't have to be a spokesperson. You don't have to come on, like what we're doing right now. You don't have to do that. But don't carry that burden alone. Share it with someone who loves you and who respects you and cares for you, at least one person, so that you're not carrying that burden alone. It's a tricky journey, and you need someone.
I agree. Christy?
I would definitely echo what Taryn just said about research. I would also add about picking a doctor, picking a surgeon. Not only find a surgeon that you feel comfortable with, that you feel comfortable can cut you open and get the job done, but is also going to have an aftercare program for you that offers a nutritionist, offers follow-up visits, really is planning on being your doctor for for the duration. Many of these places, they just kind of, not many, but I know plenty of people, I think we all do, who've had surgery and then their program just, doesn't really do much afterwards. So find a program that you feel comfortable with. And what great advice from Taryn on finding, on having that home support system. If they haven't had the surgery, they can't fully understand, but they don't need to. They just need to support you, and they need to be a cheerleader for you. And whether it's your spouse or your best friend or your kid or your some work friends, whoever, tell some people. I find that sometimes the people that aren't successful are the ones who don't tell anyone, and you kind of find out years later that they had surgery, but it was just such a secret. I just think that's hard. Again, like she said, you don't have to be a spokesperson for bariatric surgery, but do your research, and then know that bariatric surgery is the time to be selfish. It's the time to take care of you. If you don't put yourself first for this journey, you will not be successful. You have got to put yourself first. So be ready to make yourself a priority. Make that you are going to take care of you during this journey, and you will do the best you can for everyone else. But you can't make the excuses where you got to take care of your kids or your husband or your wife or your, whatever. You got to take care of you. So
love it. Pierre, advice.
Number one thing I would tell people in regards to having the surgery, and I happen to have this happen to a friend of mine. Everybody wants to have surgery, and the surgery is not cheap. It's very expensive. Depending on your job and the company you work for, before you delve into everything, you obviously do the research and everything like that, but you need to find out through your company if your insurance covers the surgery or not. I had a good friend of mine. She wanted to get the surgery, and her job doesn't have a plan to cover the surgery. So there's so many different things out there where you go through this and you can't afford it, then it definitely becomes an issue for you. So you want to make sure before you jump into everything, find out if it's covered by insurance. Even like when you go in Facebook groups, a lot of people, insurance wasn't covered by their job, and they ended up flying to Mexico or to get the surgery there. And that's like a big part of the bariatric community, about people who fly to Mexico. And, you always hear nightmares and stories about, oh, you're going to Mexico and things are going to happen. But it seemed like a large percentage of people are flying over to Mexico because they're getting the same care, and even better sometimes, going to Mexico because their company doesn't cover it as part of their insurance plan. So you definitely want to make sure that's covered. And then also you want to find out what requirement is needed, because that's the other thing. You might need to see a cardiologist. You might need to see you're going to definitely need to see a psychologist. You're going to see a nutritionist. They're going to make you get on they might tell you to lose weight first before you even have the surgery. You might have to find out about the 2-week liquid diet, where you're going to drink liquid protein for like 2 weeks to shrink your liver. So that's the first advice I'd always tell people, is to make sure you check to see what your insurance does and doesn't cover. So then that way, the right route to go to get the surgery.
Yeah. Dr. Craig said you guys should be mentors. And I think you just served as mentors to all our present and future viewers. Because, what an eloquent, thoughtful group of people I chose. I'm so glad. Every time I've asked you guys a question, I thought, gee, I'm so glad I invited her to be a part of this show. Really enlightening and exciting. I think this is a valid option. I don't dismiss surgery, and it certainly can be life-changing and life-saving, more importantly.
Yeah.
It's just, I'm so proud of you all. I'm so grateful you've made the decision and you've come so far. It's really exciting. What's next for each of you? Just give us 20 seconds. Christy, what's a big picture for you? What are you looking forward to?
I'm looking forward to seeing if my meniscus is going to hold up and I can train without doing something embarrassing on the course, and finish my first half marathon in quite some time in Richmond in November. And then dopey next year, my friend, dopey next year. So that's what I want to do. So yeah, I want to keep charging forward and figure all this stuff out.
Outstanding. Taryn?
I have been, this month I took a break. The Florida heat is a lot. So I took a break from my outdoor running. I hate running on the treadmill, and I know Fitz had to do that and train for her Boston Marathon on the treadmill. I hate treadmill running. So I said, you know what? We're going to focus on stretching, recovery in July. We're going to kick things back off here in August. Okay. And we'll, like I said, training for Dopey, and I've got 5 states so far this year. So let's see what we can do. Those are great fun vacations, but also keeps you committed to training.
Absolutely. And Pierre.
I think this probably could be another topic, and you probably could do another discussion on it in regards to weight loss. Obviously, when you lose an extreme amount of weight, you have skin issues, and plastic surgery becomes the next step to kind of solidify the program if you want to look a certain way and do certain things. I was fortunate and blessed and saved some money up over the last 4 years. As of June 23rd, I had a tummy tuck and some lipo to get rid of the excess skin around my midsection. And once again, I want to say I've seen other people out there. I was blessed in the fact that I wasn't always big, so I didn't have a lot of skin to be removed. But I did go through that process as of June 23rd, had a tummy tuck. And my ultimate goal is to keep training for races and running, but to walk the physique stage again, to compete, bodybuilding, physique. And it's funny because, last year, I think I said I did the physique competition, and I lost like 30 pounds, got down to 4% body fat, but I still had excess skin in my midsection. So no much exercising that I do and eating, I can't get rid of that. So having this surgery kind of helped me get rid of that. So now my goal is over the next 6 months to a year, train again and get to the point where I can walk on the stage and do several physique competition and hopefully do well in them.
That's exciting. And I think that actually would be a fantastic topic, the skin surgery. One of my runners in California, Corey, just had it, and he's been quite public about it too. I think he'd be a great guest. That's certainly a hot topic for a lot of people who've lost a lot of weight. Yeah, thank you for sharing that. Oh, and Christy, I don't want this to go unnoticed. This is a comment that came up while you were talking, and I didn't want the show to end without.
That is my, oh, God bless her. That is my son's very sweet girlfriend, Caitlin Davies. Yes. Thank you, Caitlin. I appreciate it.
I'm sure she's right. I feel probably 100%.
Oh, I'm embarrassed, but yeah.
Own it. All right, listen, Pierre, Christy, Taryn, I love you all very just deeply, and I'm so grateful for you. This is information I didn't have the capacity to share myself, and I'm 100% confident you've helped quite a few people out there make some good decisions for their health. So
well, thank you for giving us this platform. I really appreciate it.
Of course.
Yeah. Thank you, Fitz. I appreciate it for reaching out to me to be a part of this as well.
Of course. And now you guys have to tell everybody to get to work. Tell them.
That's it. Get to work, y'all.
Get to
work.
You can do it. We did it. You can do it.
That's right.